welcome you all on behalf of Dental Surgeons Association of India. So today we have two very special guests, Dr. Octavian and Dr. Camelia. Do watch this full video to have a complete overlook on the dental practice in current pandemic situation. He also explained the concept of slow dentistry, which will improve your practice. Along with that, don't forget to watch a tour of his clinic. So stay tuned, friends. There's a lot of things which is coming up in this video.
I welcome you all on behalf of Dental Surgeons Association of India. So today we have a very special guest, Dr. Octavian. We are really privileged to have you here, sir. Dr. Octavian is a DDS and PhD from University of Frankfurt. He is a leading implantologist and into implantologic practice since 1990. He has been a trainer and lecturer for postgraduate implantology courses in Romania, Germany, Poland, Armenia, Georgia, Italy, India, Indonesia. He has been a director and owner of Postgraduate Dental Education Center in Bucharest. He has delivered lectures across the world, and I was really amazed to see that he speaks many languages. He's a multilinguistic: English, German, Italian, Romanian, French, Spanish. So I will ask a question to him that when you are learning the Hindi, and apart from him, we have his wife also, Dr. Camelia Fagres. She is also from Romania. She is an endodontist and a leading practitioner. So I have Dr. Robin Malik also. He is National Secretary of Dental Surgeon Association of India. We have Dr. Akhilesh Tripathi. He is a young dental surgeon from India, representing the young dentists from India. So let us start with the conversation. First of all, I go to Dr. Octavian. What is the new normal for dentistry right now? We are in lockdown since so many days. India is facing a lot of issue because cases are rising each and every day. And dentistry has been changed a lot. We have to do a lot of new activities during our practices. So what are the new things you are bringing up into your clinics?
Well, first of all, thank you for the invitation to participate to this interview. And of course, Robin is an old friend, as I've been already 2 times in India lecturing, and I loved it very much. So I'm very happy to share with you my knowledge and about what happens now, because it's new for everyone. Well, basically, nothing changed.
Okay.
In the sense that all disinfection and sterilization is the same like before.
Okay.
What changed is the way we work, because we treated before people with a lot of other diseases, which mainly they are more dangerous than the coronavirus, hepatitis or HIV and so on. So what we have more is protection, first of all for the doctors, because we are exposed the whole day when we treat.
Absolutely.
In the second part, we protect also the patients who are coming into our practice. And this is, I would say, the most complicated thing. I tried to realize a special circuit from the moment the patient calls till he comes into the clinic, and from the clinic door there is a special procedure. I will show you this after that.
Okay.
And so we do what we can. 100% we will never have protection or whatever. It can't be.
I understand.
But, we can do a lot and still working in a more or less human way.
Absolutely.
One thing is, I practiced this already for years. It's the so-called slow dentistry.
Correct.
This means I'm working always with prenotation and trying not to have my waiting room full with patients. So I take my time for the treatment. Then I had at least 15 minutes break till the next patient. So I have also time, whatever, drinking a coffee or reading something. And this is now a little bit extended because we have half an hour after every patient for disinfection and sterilization.
Okay. Dr. Camelia, I want to ask one thing to you. I mean, you are into endodontic practice. I mean, it produces a lot of aerosols because most of the procedure in endodontic dentistry are with aerosols. So aerosols has been called the most dangerous thing in these days because it can become a medium of spread of infection. So how you are modifying your practice to control the production of aerosols? So we want to hear that because young dentists are also watching, so that they might get some information about that.
Of course. Hello, everybody. I'm pleased to be part of the meeting. First of all, the dentists in this period are the most exposed. We are the most exposed because of those aerosols. I didn't change a lot because I used dental dam since I was in the university, 16, 17 years ago.
Okay.
So my dental dam, the dental dam is, I use it from the beginning of my practice. The second thing I do when I'm do a cleaning or a hygiene procedure, I use the
Shield.
The shield.
That's
Okay.
the video I sent you already.
Yes, sir. I'll put that video. I'll put the video to watch our viewers, because in that video the aerosol production is there, and how to control the production of aerosol. We can get a clear idea of that in that particular video.
Yes, because we have shields and the patient has his shield.
Shields.
Yes, yes.
So this is
Yes, sir.
as much as we can do. Then the rubber dam, if we can also do cleaning under the rubber
Cleaning,
dam.
yes. The obturation, the photo obturation, I'm doing the photo obturation under the dental dam, so it's very safe.
And one more thing, which has to do every patient who is not allergic to iodium, we let them rinse their mouths with povidone iodine for 2 minutes. And the studies I read is that it's covering for 2 to 4 hours. So 99% of the virus is killed
in the mouth.
in the mouth.
In the mouth.
Great, sir. Great.
It's
So So we have Dr. Robin Malik with us. He is running a campaign, hashtag Save Dentistry in India, because you know that dentistry has been affected very badly, rest of the world also, but India, we work in a small clinics. I mean, it brings lot of employment to the dentist. It's a huge country. So Dr. Robin Malik, would you want to ask, or would you want to add on the points, what are there in the campaign?
Yeah, I would just like to ask Dr. Octavian, how your practice has suffered after COVID-19? Are the patients the same, the walk-in patients are same, or the population has stopped entering the clinic, they are avoiding the dental treatment and all? How is the thing in your country?
I would say number of patients is a little bit less because we started only 1 week ago, but not that much, because as I told in the beginning, I always had this idea of a slow dentistry. I want to have time to talk to my patients, and I did this already before. But the patients themselves, well, they trust us. They are not afraid when they're coming. They are very informed. They can ask us everything they want to know, and they think they are safe in our clinic. Because they see we did a lot. Yeah, I will show you. We did a lot also for the patients, not only for the doctors and the assistants, but also for the patients, so they can feel sure, safe.
Dr. Octavian, I just want to know, and what are the changes in the charges of the dental treatment that have happened after COVID-19 in your nation?
Well, I decided not to change anything.
That's so great, sir.
No,
that's very great.
No, we spend a lot for every patient, more than before. But everybody suffered the last 2 months about the money. Me, the patients too. So, okay, my earnings are a little bit less, but I will survive. I'm not becoming rich if I'm charging, I don't know, 5% or 10% more. This is my personal opinion. There are some doctors who are charging.
The patient to feel safe, the patient, and for us to protect ourselves. It's difficult to work under those conditions with the dressed like that and covered, 2 pair of gloves and with the shields and the loops and the microscope. It's difficult. It's not easy.
Exactly.
But we got used to it. It's important to feel safe.
It's difficult to carry all those weight for a long period of time, and we have to control the infection also, not only to us, to our patients also. We have a very young dentist, Dr. Akhilesh Tripathi. I mean, he is taking out good points from this particular discussion. So, Dr. Tripathi, what are your queries or questions, if you can ask, or you can add on something to this particular conversation?
Yeah, we young dentists of India are suffering from unemployment, and our biggest problem is unemployment. And due to COVID-19, healthcare systems have a crisis. So I think we dentists can fulfill the crisis. And if we dentists going to take a bridge course, then it will help for our healthcare system, and we dentists can explore ourselves. Fine.
Okay, I want to ask one more important question regarding the personal protective equipments. I mean, we are wearing the gowns. I mean, there are a lot of gowns in the market these days. I mean, there is an overproduction also. We can find a lot of things on social platform that people are doing this and that. So according to what is the criteria of selecting those PPE kits, what should be the thickness of the gown which we are using in the clinics? Over to you, Dr. Octavian.
Well, first of all, I will show it to you.
Okay.
I found a producer. It's a local one here from Romania. They are using a material which is already antibacterial and antiviral. You can wash it 30 times, then it becomes a normal gown. But it's easy, so it's not heavy. It's like a normal one, one way, and I think it's a good solution. Then, of course, we have the caps and the mask.
The FPP2 mask.
FPP2 mask.
Yes.
Correct. Yeah. We would definitely. We will love to watch to have a tour of your clinic also, Dr. Octavian. We have Dr. Malik. Exactly. I mean, you were talking about dental insurances thing. From India, I mean, which is not common in India. I mean, it's there in most part of the world. So, what is your take on that?
About insurances?
Dental insurances, because in India, people used to do from the pocket. The payment is from the pocket. There is no dental insurance at a commercial level in India.
Well, I would say 95% is private. Me, I have only private clinic, and insurance here in Romania pays very less. So they have a budget which you can finish it within 2 hours with one patient, and then for the others there is no budget in there. So most dentistry in Romania is private. For myself, as I worked also in Germany, where there is an insurance for 95%, it's the other way around. I don't like the insurances, the official ones, the state ones. Private insurance can do everyone, but the official ones in Germany, for example, they force you to some kind of treatments, to cheap treatments. And for myself, I decided I want to decide the treatment together with my patient. He and me, we both are responsible for the treatment plan. No insurances and nothing should be able to decide what to do or not, what is the right treatment or not. But this is my personal decision. And there are some people who say, why don't we have insurances here in Romania like in Germany or in France? They don't know what it means. I'm a free practitioner and I want to continue to be it. That's why I left Germany many years ago, because I couldn't stand these insurances.
Correct. You are into implantology since 1990. So implantology has been changed a lot since 3 decades you are into the practice. So what are the precautions you take when you are planning to do an implant case? Because the physio dispenser, you have to put saline there, and there is a splash of that saline also. So are you taking the same precaution? Ma'am has said about that. You're covering the face with the shield.
More or less, because but I see surgery is not that dangerous like making a filling or something like that. Then in implantology, I use sometimes
irrigation.
I don't even use water or saline solution.
Yes.
I'm using it with 60 to 90 RPM.
Okay.
So you don't need solution at this speed, and it's very easy. That's the way I'm treating it already before, because so I can see more. I like to feel the bone, and at the low rotation, you can feel it better.
Okay.
And especially if you make borderline treatments, nerve or sinus, then you can feel it. It can react.
Exactly. Dr. Robin want to ask. Yeah, please go ahead, ma'am. Please.
I'm sorry, as want to complete something. We decided to work, all of us, we decided to work with low rotation handpieces, red handpieces.
Not turbines.
Not turbines.
No,
with the red.
Yes,
red
makes
handpiece.
less aerosol.
Less aerosol.
Okay, that's very important these days. I mean, Dr. Robin, would you like to ask something? You're talking about the ratio of the dentist. You can go ahead.
Yeah, Dr. Octavian, what is the ratio of the dentists in Romania to the population? How many number of dentists are there in Romania, and can you share some data if you?
Well, there are about 22,000 dentists in Romania and about 20 million inhabitants. So, if you take it, it's between 900 and 1,000.
Okay, that's great. And Octavian, what is like in Romania, like in your country, the number of clinics, how the standard of clinics, the single chair clinics, 2-chair clinics, what is the like, most of them are like large clinics or small clinics are there?
Most of them are small clinics. Then there are clinics like mine. I have 3 chairs, and there are multinational clinics like McDonald's.
Okay, so corporates.
Corporate, yeah.
Yes.
But there are a few. There are 3 or 4, something like that.
Because the thing we are facing in India now, what is happening with us, the Dental Council of India has shared, the ministry has shared some guidelines for the protocols for the COVID-19 to practice dentistry. The problem is that most of the clinics in India are run from the 150 square feet to 200 square feet, very small area, and it's very difficult to follow all the protocols in that small area, because we have to wear our gown and then dispose it off and all that. It's very difficult for us. So how you people are doing in like small clinics? Can you share something if you know?
Well, it's you have, first of all, you have to reduce your frequency. You should do planning on the phone when the patients are calling. You shouldn't have patients just coming in and waiting, because this is the problem. Not to clean up or to sterilize the clinic. Even for small clinics, there are good solutions, but it needs time. So, for example, we use also UVC lamps with ozone, which is, if there is a room 20 square meters or something, in 15 minutes is serialized. Then you have to refresh the air for 10 minutes. So it means about half an hour between every patient. So I think this UVC lamps with ozone is a good solution for all clinics, especially also for the small ones, because it's cheap. I don't know, it costs about $40 or something, or $50, something like that. And you have a very good sterilization. So, and the rest of disinfection and sterilization you did already before. So one thing you have to add is your protection.
The UVC lamp.
Yeah. And you in India also had already a lot of diseases. So you had to take care also before, not only now.
Yeah, absolutely.
So in India, we have around 2,77,000 registered dentists. I mean, there are a lot of quacks which are filling the shoes of the dentists, registered dentists. I mean, Dr. Robin Malik would like to talk about that, because he's running a campaign called Save Dentistry in India, because India is a big country. I mean, Dr. Akhilesh want to add on for unemployment also. Dr. Malik, what exactly you're doing for anti-quackery drive from Dental Surgeon Association of India?
Well, we are just collecting the data of the quacks working in the country, because in this COVID-19 lockdown period, our clinics are shut down, but they are working without any protocols. They are doing all patients and all. So we have just collecting the data, and we are sharing it with the government. We have to take action against them, and otherwise it will be another hotspot for the COVID-19.
Exactly. Dr. Akhilesh, you would want to add for unemployment things, because you are a young dentist. You are representing the youth of dentists in India, and you have to take down the future for the dentists in India. So would you want to add something?
Yeah. Young dentists have a big problem, like a big challenge, you can say, unemployment.
Thank you, Dr. Akhilesh. And at last, as you promised that we would like to have a tour of your clinic, so that our young dentists should actually understand how to do the protocols and how to take up the patients. I mean, that will be a great help, Dr. Octavian. We really are looking forward for your information on that.
Yeah, we will start then right from the entrance. So,
okay, sir.
I'm on the way to it. So I show you the entrance. Just a second. Okay. So just changing. Okay. So and here is written that everyone has to wear a mask.
Okay.
Okay. Now we come inside. So here on the right side is a reception where the patient gets his instructions. He has to fill out some forms that he wasn't sick the last 14 days. He didn't cough and all this stuff. There are a few questions. So then he gets his instructions. So what he has to do when he comes in, here is for the shoes. It's a solution. You can go out here, and it disinfects. Then they put on this plastic shoes.
Okay.
They get it gone.
Okay.
And a mask. No, they usually come with a mask already, and the cap. Okay.
Okay.
You measure their temperature, yes.
Okay.
And then first I show you all over. You see, I did a lot of changes here with all this division. And now this
okay.
is. This
I can see you have put up a cover. I mean, some kind of tent kind of a thing you have put up there.
Yes, right.
What exactly it is this?
Then after, when they're ready, they're coming here inside to the waiting room. And you see there is a social distance for at least 2 meters. Only 3 chairs. So then they're waiting here. Then when ready to start the treatment, they're coming out from the other door and they're going right into the practice. This is where I'm working, where I'm doing surgery.
Okay.
Okay. Here, this is the shield. No, this is a shield.
Okay, sir.
Yeah, like this.
So.
You can use it like this.
And we put this also on patients when we have aerosols.
Correct.
Just work under the shield.
Yeah. Okay, so I'll show you, making just a little tour. So here you see also the reception from the other side. It's also closed and covered.
Okay.
Where the assistant is. Then here is where my wife works, where she's doing endo with microscope and everything. So, so this is here the
UVC lamp.
yeah, can switch it on. You see? Okay.
The important is when you turn on the lamp, all the doors should be closed. No one should be inside while the lamp is working.
Yeah.
It's very important.
Okay.
Okay. Now I show you the third room. Here you see on the right side reception, but nobody can touch it. And here this is the third room where we have X-ray, the big X-ray, and we're doing smaller things usually in this room. So okay, then the patient comes out, and he didn't pass anymore through the waiting room. We have here where he comes out, turning around.
Okay.
Now, and then here he can throw his stuff away in this
Correct.
thing. So, and okay, then here we go back to the office. We have also here a door so no patient can come in.
Okay.
Now I show you the gowns we have.
Okay.
Where we change. No?
Okay.
This is where? Yes. Okay.
Okay.
So this is a gown I could wear only 4 days.
Okay.
It's like a ski costume.
Okay. Absolutely. This is a new costume for the doctors now.
Yeah.
Yes.
No, but this is now she's gonna show you the one I told you.
But
This is the one
Okay.
I'm using it, which I told you, which is very
very light.
very light, yes, and it's antibacterial and antiviral.
Oh, that's nice, sir.
Once
No,
the
no.
virus comes on the gown, it goes away.
It pops, and it's very resistant.
It's comfortable to work with.
Great. Is it a disposable gown, sir? I mean, you do autoclave it. It's a disposable one.
Pardon?
Disposable.
Is it a disposable gowns? These are?
Or auto.
You can wash it.
You can wash it 30 times.
Oh, can be reused.
Yes.
30 times.
30
That's
times.
great. That's really
30
great.
times. And then after finishing work, every gown comes here inside when we change, and we also put the lamp for 30 minutes, the lamp in the zone.
Okay, sir.
Okay, so let's go back. Do you have any questions? Because maybe I forgot something to say. Okay, now here I'm back. Okay.
That's really great. I mean, you are managing the station, the workstation very nicely and precisely. I mean, It's good that you're taking all the precautions to take up the patients. I mean, any suggestion from your side to the practitioner, young practitioner from in India? Since you know the condition in India is like we work in a very small clinics. So
I'm trying to think cheap but good solutions. First of all, is povidone iodine for every patient. This should be for sure, because it's a thing which works. You just have to ask the patient if he is allergic against iod.
To iod.
Then, of course, the gowns you can use throwaway ones. I don't know what kind of gowns you find in India
on the market,
but important is to cover yourself. Use your masks. Always disinfection of the hands
and of the gloves also.
And before you take off the gloves, you should use some disinfection. You work with the patient, finish the disinfection, then you take them off. You know.
Correct. It's a time to adopt new things, and it takes time to adopt new things.
That's right. I think within a few months it will be okay again.
Absolutely.
But people have to respect only some things. Hygiene is very important.
Exactly.
This is the first thing, not only for us doctors, but also for the population.
And of course, they have to write to be sincere and to answer sincerely to all the questions we ask them.
Absolutely, sir.
If they had a contact with the person who was infected, if they travel,
if they have symptoms.
Exactly, that's very important.
The temperature is not
sure
enough.
Very true.
And Dr. Octavian, what else, like in your diet, how you have changed your diet to increase your immunity?
Well, since to be honest, you can take vitamin D, other things which makes you happy, but I had a glass of red wine. And a cigarette.
Sir, you are multilinguistic. I mean, when you are learning Hindi from Dr. Robin Malik, I missed that question. Now, the new normal is namaste. I mean, the whole world is saying namaste now. No handshaking.
Yes, because so you don't have to shake hands. So.
Yeah,
absolutely.
Social distancing.
We miss your food.
Yeah, that's very spicy. I don't know if German eats spicy foods.
No, but spicy is healthy.
It is very healthy.
Exactly.
The curcuma, I take curcuma as a support for my immunity. Curcuma and also vegetables and fruits. And it's very important to eat fresh vegetables.
In India, we follow Ayurveda. If you might have heard about that. We use turmeric, we use kada. Kada is beverage you can drink and you can save yourself and your immunity can rise up. Dr. Malik, it was a very nice session. Would you like to do any submission? It was really great. Our young dentists have learned a lot, whether it's an immunity, whether it's a practice. I mean, it's a multi-directional approach in this particular conversation.
Well, I just like to thank my friend Dr. Octavian and Dr. So thanks a lot for sharing your experience and sharing all the details and your knowledge. And we hope to see you soon. Thanks a lot and be safe.
Stay safe.
You're very welcome. And it was a pleasure to see you again. And I hope we can see us live as soon as possible when all these things are over. So coming to lecture about all the nice things we lived during this period.
Yeah, I think now we can have a conference on COVID-19 after 1 year to share our experiences.
Right.
Very nice.
And we'll be waiting to have spicy food in dinner with Dr. Robin Malik. Yeah.
Okay.
Okay,
So-
fine. Thanks a lot.
It was a pleasure. Namaste.
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 It was a pleasure.
Thank you.
Thank you.
So, thank you.